disruptive in the future. We've got 3 great presentations and panelists today. They'll each speak for about 15 minutes, and we'll have 15 minutes at the end for some question and answers. My name is Mark Castleman. I'm the CEO of Coach, Canada's Health Informatics Association, and we're really pleased to bring you some of this disruptive thinking today. Our first speaker today, I'll introduce all 3 speakers, and then we'll have them come up individually. Kenneth Yep. Kenneth is with QOC Health, and he brings a decade of experience delivering scalable mobile projects for Fortune 500 companies with full-stack capabilities specializing in iOS. And his passion really lies in entrepreneurship and delivering compelling mobile solutions. So we'll welcome Kenneth. Next, we'll have Sharan Isaacs as one of our panelists. Sharan, give us a wave over here. Sharan is the Senior Director of Regional Information Portfolio. Sharan's been the senior management team working on both the academic medical side as well as with the CCAC, Community Care Access Center, delivering care into the community, and is responsible for driving the information management strategy for both those organizations as well as creating a really amazing connected care environment. Sharan's expertise lies in leading complex, large-scale transformation projects and overseeing established regional programs in IMIT. Finally, we'll have Mike Martin from IBM Canada, Senior Executive, leading the Internet of Things and IBM's Network Services team, focused on mining oil and gas, utilities, transportation, and smarter city solutions. Michael's got 25 countries over the past 5 years. He's certainly got his silver pass for Air Canada. And in the last 12 years, he's been working on business and technical guidance for a variety of industries, including healthcare. He's going to share with us some of his thoughts today on IoT and some smart devices. So we've got 3 great disruptive thinkers. We'll leave you with Kenneth Yip to get started.
Thank you, Mark. So I'm here today with my colleague as well, Nate over there. He's one of our UI user experience teams. And thank you all for coming. Good afternoon. Hope everyone's doing well, and especially with all the talks today. So today, my talk will be about the future of healthcare. So what I'd like to actually go through. Okay, what I'd like to talk to you guys about is the future of healthcare. And if there's one thing I'd like to leave with you today, is for you to think about your experiences with healthcare and how technology can help to make this experience better. So again, how your experiences with healthcare are today and how technology can make it better. All right. So what I'm going to do is I'm going to talk about the sorry about that. Let me share with you, for example, my experience with these experiences with healthcare. So if I wanted to see my doctor, some of the things that I needed to do is I need to call the reception. I need to first try and schedule an appointment. And after I do that, I may need to wait a day or 2 before my appointment is actually there. And then even being sick, I may need to drive there. And these are all points of friction. After arriving, doing some paperwork, I need to wait another 45 an hour before I can actually see the doctor. And this experience, it's painful, it's frustrating. And then after seeing the doctor, there may be some additional visits or other things that need to be done. And so, rinse and repeat. This is a frustrating experience. And I want you to continuously think about your experiences with health to think about what is that end-to-end experience like. So we know that healthcare hasn't changed much, especially my experience that I've shared with you, my experiences with healthcare. It's like a dinosaur. But we need it to be dynamic. We need it to be dynamic for our aging population, the people here today that are going to become these dinosaurs. So we need this dynamic system, something that can work for our needs, for our populations. Thankfully, there is actually technology in healthcare that are continuing to innovate and actually help with healthcare. So for example, Akira, the ability to actually have a video conference with your doctor, or open care, being able to schedule on-demand visits with health doctors. Some of the things that we're doing at QOC is, for example, with the Northumberland Hospital for the Project PATH, we're able to help elderlies create virtual visits with their health providers. So essentially, they don't need to drive an hour and a half before they get to the hospital to visit their doctor or health provider for a 15-minute visit. They can just call it, schedule the appointment, and call it and have that virtual visit. With William Mauser, we're able to track and monitor the patients, and essentially have the nurses be able to monitor the patient's wounds after a surgery, being able to take pictures of their wounds, being able to see temperature and health of it, so that in that critical period, if there were some things that don't work well, it can be addressed immediately. So let's take a look at some of these building blocks of technology that can actually surface, these different technologies. I'm going to talk about, and it all centers around, for example, this innovation with mobile devices. There's, for example, virtual reality, augmented reality, virtual conferences, messaging, chatbots, Internet of Things, big data, all these big terms. You might be wondering, okay, well, what are these things? Well, I'll dive into that with some of the examples, and hopefully, as you think about that end-to-end experience, you can also envision and imagine what kind of things we can do in the future. So taking, for example, my experience with healthcare, imagine if instead all I needed to do was talk to a chatbot so it can intelligently schedule my visit with my doctor. When the time comes, instead of waiting, it can say, hey, you're next in line, why don't you put on your goggles, your headset, to experience virtual reality, essentially be in the same room, somewhere completely different, and engage with the doctor. So this is how I envision, for example, something like virtual reality, being in a place and experiencing something completely different. So after I'm done, all I have to do is take off my headset, and the chatbot can follow up with me for anything else. This seamless experience is one that we can achieve in the future. Can you imagine some of these technologies in your experience as you're thinking about your healthcare experience? For example, another example is, for example, big data. This may seem like a term that's, what is big data? What does it all mean? Big data is essentially the aggregate of information so that you can see the trends, so that you can get better insights into decision making and being able to take actions upon it. And this pairs extremely well with something like artificial intelligence. Artificial intelligence is technology being able to achieve certain tasks, or being able to actually solve problems. And pairing it with actual data, a lot of data, it can become better at decision making and yielding much better results. So in the case of my healthcare experience, for example, if, for example, the chatbot had access to the big data and had the technology of artificial intelligence inside of it, what it can do is it might know that, hey, I don't have a car, or maybe, hey, I'm too sick to actually go to the doctor's office. So maybe what the chatbot can do is ask me, hey, do you need a ride? And it can just schedule the Uber for it to come pick me up. And then in the future, maybe even driverless cars, for it to go there directly. I just hop in and go there. Can you see some of this technology as a part of your healthcare experience? So 3D printing. 3D printing can be used in today's technology to be able to, for example, print out skin, actual tissue for burn patients. Or, for example, I hope I'm loud enough. All right, does this help? Yeah, no help? Okay. So, for example, another thing is being able to print out muscle tissue, so that they can repair muscles. But one of the biggest things is the Internet of Things. This is a huge, convoluted concept. What is the Internet of Things? In short, it's anything and everything that can be connected to the Internet. So let me give you some examples. So essentially, even light sensors, things that can input information, things that can output and make actions. So for example, light sensors that can track your pulse and heart rate. Or for example, accelerometers that can detect when someone is about to fall, and then some sort of actionable to alert everyone nearby. Or for example, things like temperature sensors, all having this ability to funnel in this information so that we can action on it. And of course, there's wearables, which is also part of this Internet of Things. And I'd like to share with you a personal story of how I came to actually wear this wearable here, this smartwatch. So my father, he actually had a heart attack a couple months ago. And I was thinking about, and the doctor essentially was saying, okay, well, after this heart attack, you gotta make sure you exercise right and you eat right. And so this is a huge change for him because he doesn't exercise. He's one of those people that's a couch potato and watches Netflix. So in order to get him to be active and do more exercise, my thoughts was, okay, well, maybe I can get him a smartwatch to help track his activity, his exercise, his sleep patterns, what he's eating, be able to track his pulse as well. All these great things. But unfortunately, it didn't end up the way that I expected. And so it lacked the mental, the emotional capabilities. And so the next step was, okay, why don't we use this technology, right, and actually bring it into our family circle. So I got one for my brother, my mother, as well as my uncles, which are his brothers. And we all started doing more activity together. It created this mental support. So the idea of creating circles of care around technology is what we need to do. We need to think about how technology can create these different circles of care and use it at the right time, at the right moments. So let me share another story. The other day, my brother, he went to Wonderland. Of course, he did a lot of exercise, so he was ranked at the top. But then my dad, all he did was he updated his phone and he smirked and he was now on the leaderboards. This is the type of competition, the motivation that keeps him going, and it fuels this exercise routine that he does every day now. So can you imagine how technology can actually grow not just for this social circle, but into healthcare, into both healthcare as well as preventative care. So your gyms, your fitness, your community, all these engagements, and having it in a unified platform so that you can deliver actual technologies in the right place at the right time. Being able to share this information with your doctors at the right time so that they can provide this higher level of care for you. And this is the vision of QOC Health. We want to be able to create technology that can actually help with all these circles of care. So as you are thinking about the different health experiences and what type of technologies that is possible with that, I'd like to actually help you realize that solution. But the problem is that there's so many barriers, right? There's so much friction around it. So the reason why I'm so passionate about what we're doing at QOC is because we were able to tackle all these challenges. So you don't need to spend years trying to do your integrations, worrying about the security, privacy, integrations, working with different partners, connecting with the hospitals or the clinics. This is all done. So when you're thinking about that health experience with the new technology, we can actually help to realize this. So the platform itself can allow you to be able, can scale across different scenarios, and it's built and designed ground up for that purpose. So I would like you to come talk to us at the end of this presentation. Share with us your experiences. Share with us those ideas that you have for this health experience. How can we bring this to life? We've already done all this, spent the last 7 years creating this platform that reduces all those barriers so that you can go just get up and running to implement your ideas. Join us on this journey to realizing these health innovative solutions and act on it. So instead of just thinking about it, come talk to us. See how we can actually realize these solutions together. My name is Kenneth, QOC Health. Thank you.